Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and today we will start ENT, which stands for ear, nose and throat, and our first lecture on this ENT is assessment of hearing. We divided our lecture into 5 sections. In the first section, we will talk about the initial examination, in which we will talk about what's the hearing and how the hearing process occurs. Then we will talk about the assessment of hearing and different types of hearing loss. Then in the second section, we will talk about some clinical tests that are performed to assess the hearing, in which the common ones are finger friction test, voice test and speech test, and also tuning fork test. Then in the third section, we will talk about some audiometric tests like pure tone audiometry, speech audiometry and Bach audiometry, and then impedance audiometry. Then some special tests for the assessment of hearing include recruitment, short increment sensitivity index, threshold tone decay test, and autoacoustic emission. Then we will talk about some central auditory tests. Then in the fifth and final section, we will talk about evoked response audiometry, in which we will talk about electrocochleography, auditory brainstem response, and auditory steady state response. So all these 5 sections will pretty much cover all about the assessment of hearing and how different tests are performed to find out the hearing problems depending on the age and the nature of the problem. So hopefully you are interested to learn more about this topic, assessment of hearing. So keep watching sqadia.com.